Hi everybody, welcome back to the channel. This is Dr. B Addiction Recovery, and the topic I want to discuss today is the value or utility of urine drug testing within the context of substance abuse treatment, whether it's inpatient or outpatient. Let's get started. The way this issue came to my mind, although I have spoken about it before, is I just read a wonderfully written article in JAMA. I think it was published last month or the month before, and a commentary. And they had done a study, and they had utilized urine drug testing in what's called a cross-sectional study to make a correlation, not a causation analysis, a correlation analysis with overdose deaths. I'm going to make a video about that. I don't know if it's going to come out before this one or afterwards, but that is what kind of spawned the thought. They looked at 500,000 snapshot in time of urine drug tests ordered. And when I was looking at this study, I realized that these were all urine drug tests that were sent to a formal urine drug testing laboratory. And what does that mean? That means these tests used what's called the chromatography standard or method of evaluation. They're highly sensitive, they're highly specific, and give you a lot of information. In fact, I would argue that most of the time when they're ordered, they give you too much useless information at great cost to the system, financially and resources. But that is what sort of spawned my thought on this, and I thought I would visit it. Before I discuss or tell you about or really get into the value of urine drug testing in substance abuse treatment, how it can help diagnose and how it can guide treatment, right? Before I do that, I want to make some general comments about clinical testing, medical tests, and in fact this applies to psychological battery of tests. Why does it do that? Because the mathematical constructs of these tests, in terms of or insofar as you interpret them as the clinician or the one ordering it, and what values mean, are based in mathematics and probability theory. We're not going to do mathematics or probability theory here, but if you pay attention with the comments I make about general testing and then distill it down to urine drug testing in the setting of substance abuse treatment, you may know more than even most healthcare workers understand about the test that they are ordering, and this will guide you through life as you move through the healthcare system nowadays and moving forward, where way too many tests are ordered at great cost to the system, resources, finances, but I think most importantly, or at least as it applies to you, the individual, there is a health cost to ordering these tests. Let me begin. All tests are based, as I said, in mathematical concepts insofar as you diagnose, evaluate, interpret, and draw conclusions from so you can move forward, whether they're psychological tests or medical tests. More particularly, that mathematical concept that I am referring to in this concept is probability theory. Really based there, but that doesn't matter, whatever. Okay. So let me give you an example here so you can sort of understand it. Nowadays, in the 21st century, a person will feel sick. Okay, I have a cold. Okay, all right, you have a cold. The same thing everybody's had for the last few 100,000 years, couple million years. That's what human beings do. They pick up viruses and they get colds. Okay, they might get a... And before they even see any practitioner, somebody comes up to them, 6,000 vials of blood are drawn, someone else comes up to them, they're picked up, carted away, a chest x-ray is taken, maybe if the complaint is sufficient enough, oh, my head hurts. I've been having headaches for the last 30 years, but I got a headache. A CT scan of the head is done. They go back out, they sit down, eventually somebody comes to them, If they're lucky, they do a periphery exam. If they're lucky, they ask 3 questions and tell them this, that, whatever. And more often than not, or should be, they hand them a prescription. You go home. You're elated. They tested everything. There's nothing wrong with me. In fact, he didn't give me anything. Or you go home, and he gives you some antibiotics, okay? Or she gives you some antibiotics. And you think you got star-studded treatment there by all of these tests done. Wrong. In fact, many times you're harmed by that. Let me try and explain this to you. Let's start with one simple test, something that most of you may be familiar with, CBC, complete blood count, okay? And one of the things that the CBC shows is a white blood cell count. And in fact, if indicated or if ordered as such, that white blood count comes back with a differential, okay? It breaks it down to the components of the white blood system, okay, immune system, of which immune white blood cells have been lit up and are firing and how active they are, okay? So let's just take that test, CBC. I'm a practitioner who's never seen you. I haven't heard your what's called the chief complaint, okay? I haven't heard why you're here from you. It's just written on the board or it's written on the nurse's note. And all these things are triggered and ordered immediate. That is not how any of these tests were constructed to perform and be interpreted at all. And every single day, thousands of people go to doctors, emergency rooms, urgent cares, and in fact, psychological testing and so forth. And this is how tests are performed. I argue that the tests are uninterpretable and potentially dangerous at times. Now always remember, there's exceptions to this, and I'm making generalized statements for the point of teaching how these things should be done, and then we're going to apply this to urine drug testing, okay? When you order a test, let's say CBC, it depends and relies, the mathematics of that test rely on the practitioner, having a reason for ordering the test. If you have a reason to order the test, and when I say reason, I mean professional reason, someone who's well versed in the art and science of the clinical practice that they are undertaking. It's not, hey, do I have a cold? Let me have a test. It's much more, this person is 65 years old, they have a history of COPD, diabetes, heart failure, they are presenting in the middle of flu season with 18 days of worsening cough. And they're also complaining of a fever. Okay? All right, now I'm going to ask a second question, and that question might be dictated by having them get a CBC. But these tests only mean something if the practitioner is well versed in the practice of what they are doing in that setting, and then they need an additional question answered if they can't get the answer by seeing and evaluating the patient. And then that test adds to what's initially called history. The history, there's a chief complaint, why are you here? And then there's a history, okay? You ask the person a series of questions, and as you do it over time, you get better and better and better at interpreting the history. And sometimes the history doesn't give you the full answer. At that point, you add laboratory testing and radiological testing. The chase of it is, a test is only good in the setting of a practitioner having a very specific reason for ordering that test, and the answer to that test will make sense to them because they have an understanding of why they're ordering that test, and they will make certain decisions to move forward. That's it. It's not my opinion. That's probability theory, okay? It's mysterious. It's interesting. It's fascinating. In fact, I will say that all natural phenomena are based in probability theory, and nothing is 100%. Okay, it's about probability. In fact, when you get into the world of what's called quantum mechanics, which some of you may be well versed in it, much better than I am, which is classical mechanics, is what we call physics, right? I hit a pool ball, and then it's going to go at this speed and hit that ball and go in that direction, and there are a set of equations that inform a person so they can predict those things. When you get into a really, really, really small physical world, super microscopic physical world, those laws don't apply anymore. And then you use a set of equations from quantum mechanics to tell you the probability of outcomes. In that same sense, and I'm only telling you, in the clinical world, you're sort of dealing with the same thing with probability theory, and it only makes sense if the person ordering the test has a reason. Now let's move to urine drug testing in the setting of substance abuse treatment. Okay, when I looked at this study, 500,000 tests were looked at, and the first thought I had was, wait, are these point of care urine testing, or are these sent to the laboratory for chromatography and extensive analysis? Oftentimes, in the substance abuse world, these very expensive, highly specific and sensitive tests are ordered to give you minutia details, some of which is not even interpretable in the first place, no matter how experienced you are, because it's not supposed to be, at great cost to the insurance companies, the pocketbook. Let's talk about that for a second. I give you some background on testing in general. Okay, now we're going to talk about these urine drug tests. Okay, there's the point of care testing. You pee in a cup, 12 panel, 13 panel, fentanyl strips. There's some of the alcohol ones. What we're going to exclude in this discussion is forensic testing, whether it's in criminal or family court for substance abuse. We're going to skip that for now, discuss that maybe in another lecture. But when you are admitted to treatment, or you go to a doctor's office to get your Suboxone and so forth, right, what testing is done? Okay, let's talk about these highly specific, sensitive tests that give you minutia and details. Okay, several years ago when I got into this field and had left the university, I was a couple of different treatment centers would hire you as their medical director or doctor, and somebody would walk up to me and say, hey, sign this. What is this? It's a standing order for urine drug test. Okay, who are you? Why would I sign a standing order from you? I might sign a standing order in a hospital where a person needs an AccuCheck every 45 minutes because they have an overdose on some anti-insulin medication. Yes, anti-insulin medication to bring their pro-insulin medication to bring their sugar down, and they've overdosed on it, and I might sign a standing order. I've decided that the half-life of this medication is so-and-so, so I'm going to sign a standing order and give it to the nurse and say, look, every 45 minutes, do an AccuCheck so we make sure this guy's blood sugar doesn't go down. Most of the time they're on monitor anyway, but I'm just giving you an example. That's a standing order. It stands, and they don't have to ask your permission. I have Joe Blow coming up to me asking me for signing a standing order for a urine drug screen. I look, it's the most expensive, most specific, most sensitive, most technologically advanced urine drug screen 3 times a week on everybody in treatment. And I'm looking at this guy like he's crazy. It was a completely foreign idea to me. I don't do that. And I would give it back saying, I don't do that. I decide, and we don't need this. Point of care is sufficient. Then the argument would become, hey, it needs to need it for insurance companies. Hey, we need to keep track. How else are we going to keep track of how these guys are doing? They were wrong about every one of these issues. It's not the urine drug test. And in fact, many of these people got in trouble, got fined, some got prison sentences and so forth. And thankfully, I kind of stayed away from it as much as I could, but I lost a lot of jobs in the beginning because I'm like, I'm not doing that. That's not good for the patient, and I don't want a standing order of a test that's $1,000 every time, okay? When a patient comes in and you want to evaluate them, first thing you do, whether it's substance abuse or diabetes, you see what the chief complaint is. Heroin, I want to quit this, I want to do that, I want to get on benzos, whatever it is. You make an evaluation from that chief complaint. Then you get a history of present illness, and complete what's called the present history of present illness, and you complete a full history to that past medical history, social history, smoking history, depending how deep you want to go on it, but to a certain extent. At that point, you decide what test you want on the person. Now, it is not a bad idea. And in fact, you're going to be looked at funny by insurance companies and so forth. Not that they're correct, but if you don't do some sort of drug testing. And I just do a point of care testing, and it's useful because it informs me to a great extent about other substances they're in. For example, nowadays, a guy might come and tell me I'm doing heroin, and then his urine comes back MDMA, methamphetamines, fentanyl, marijuana, a few other things, and then you approach him again and you're like, look, are you doing meth? No, I'm not. Are you doing fentanyl? No, I'm not. Okay, well, if you're not, it's cut with it, okay? If you are, I'm going to know, okay? Do you do meth? No, I don't do methamphetamines. Here's the thing. I could do a few things right there. I could take that urine sample, send it for formal testing, with very sensitive and specific data, figure out, wow, is it really in there, even though he's telling me he's not? I shouldn't do that. Here's why. All the drugs nowadays are cut with multiple different things. Methamphetamine, MDMA, who knows, whatever. The Seroquel. So it's completely consistent and in line with what is happening out there. 2, if he's lying to me, how long do you think before I know? His next visit in a few days, 1 week, 2 weeks, 3 weeks? Either A, his clinical disposition is going to change, and I'll see one of these times where he's high on meth or have some stigmata on his body in physical exam. Or B, the urine will keep popping up positive. At that point, instead of doing the $2 urine cup that I do in the office, and he keeps denying it, now I have a choice to send it further testing. I have a very specific question, and his history is not matching up with the clinical data, okay, whether he's looking weird or whether the urine keeps popping up. And I do the urine both to keep law enforcement happy and to keep the insurance companies happy, but I'm always conscientious of when and why I do it. Now I have a question where I can send that very expensive urine drug test and really get some sort of an answer to all of this, okay? You are on medication-assisted treatment. Why is it still coming up positive? Here's the point. Evaluation, diagnosis, and treatment is not guided and does not need to be guided by ordering extremely expensive urine tests. If you are a stable patient and you're coming in once a month and you get medication refill, okay, I get a office point of care urine cup, really just for documentation, keep the insurance happy, keep law enforcement happy. And there's times when they're very stable, I don't get it. You don't need to get it. The recommendations say, what is your judgment, clinical judgment? Do I have a judgment, or do I just look at that? Okay, a monkey could order a test. So, urine drug testing should be kept at a minimum, A. B. Ordered only if indicated, and regular office visits or a new patient requires quite a few of them, but you can do point of care testing that is cheap, cost effective, and it is not as good as doing the really expensive test that you send to the laboratory using chromatography, and it's a lot of different things. But do I need it? How does it change my treatment if I send the really expensive one versus the crappy one? My evaluation and treatment course should not depend on a urine drug test. If you understand this concept, which I initially started out with, let's hold on a second and go back to that. Your clinical course and diagnoses and outcome should simply depend on my clinical evaluation, judgment, and decision making, and sometimes using the urine. If you understand what I'm trying to say here, you can apply this idea to all of your medical services. And in fact, this applies even more to a battery of psychological testing, right? Psychological testing is even more difficult than a blood test or urine test or even some of the imaging. Now you're so much further removed from anything physical, okay? You can still apply the probability data theory, the fact that the test is couched in these mathematics, but it's even more elusive and more difficult, and you need a lot more experience probably to make a really good evaluation and diagnosis using the battery of psychological tests available to folks. But other area that this really becomes sort of important is the relationship you built with the patient, okay? Number one, you have to make sure they understand a few things. Testing is not an antagonistic thing, okay? Testing is just part of your treatment cycle. All the things that we have to do, whether it's medication, the physical exam, seeing me, showing how you look at certain times, testing is just part of that. B, I do make it also clear to them, look, you've been clean for 4 years. If I see a reason, I would get a basic urine test, but I have to do it because you're still on medication. If I did it for 6 months without getting a test on you, I would look funny and maybe the DEA would look at me or something. I don't know. So I keep it consistent for everybody across the board. The times that I do need to get something extra, I get my urine test and send it to the lab and then have a discussion with the patient. Really, let's think about what I'm saying here and kind of sum it up in a way that you can really digest it. Substance abuse diagnosis doesn't necessarily depend on testing. It depends on the clinical interview and examination. Over-testing or testing with the highest technologically advanced test is not a good thing, you know. It's lining somebody's pockets, but it's not a good thing. Most of the time it's not necessary. And even at times, false positive of tests, for example, guy's been eating poppy seeds. This is for point of care testing, but a guy's eating poppy seeds and you keep testing him and it keeps popping up positive. Now you have to deal with talking to him. He's like scared. No, I swear to God, I'm not doing that. What's going on and so on. So keep in mind, testing excessively also has negative consequences as well, and this applies across the board to all medical tests. So your diagnoses and your treatment do not depend on the urine drug test, okay? It should be, for the most part, a lax thing as part of the office visit, and even if you're in treatment, part of the treatment visit. And you know, they don't need a test every 3 or 4 days. You know, a guy comes in for heroin, you know, you can do one point of care testing. He's telling you, I'm coming in for treatment for heroin. Do a point of care. That point of care should inform me quite a bit, okay? Repeat the point of care in a week if you need to, but if the guy's continuing to use that pathological process is going to declare itself. Okay, very few people get to continue to use without external signs or symptoms of it. If he's presenting in a way that looks like he's still using and the point of care drug test is positive, but he fully denies it, at that point you send it for a very expensive urine test. Otherwise, testing should be minimal. It should only be used to supplement a clinical evaluation, diagnosis, and plan. And doing the very expensive testing is really overused, overutilized, and it's expensive to the insurance companies. It's costly to the system. Somebody's making money, but overall, every one of our costs generally goes up. Testing, the clinician, and the patient should have a good understanding and relationship while you're being tested. It's not punitive, but part of your treatment cycle or outcomes, and some of it is because we need to do it for potentially the insurance company or law enforcement. I hope that helped. I hope that gave you some insight and understanding into testing in general and substance abuse testing. If you liked the video, give me a thumbs up, subscribe to the channel. If you disagree with me or if you have some thoughts and comments, please generate a discussion below, and don't forget we have Patreon. Thank you very much for your time. See you guys soon.